Hello, I'm Dr. James Newman, and today we're going to be talking about rhinoplasty or nasal surgery. Many people hear about nasal surgery or they see a family member or somebody in the media who has a bandage on their nose and oftentimes wonder, well, what type of procedure was performed. Rhinoplasty refers to a procedure where we're basically reshaping the nose. In addition, we oftentimes correct functional problems of the breathing system to allow patients to breathe better not only during the day but also at nighttime. So rhinoplasty is a surgical procedure performed usually within about 1 to 2 hours in an accredited operating facility here at Premier Plastic Surgery. There are many indications for performing a rhinoplasty. The most common indications that we see in our practice here are typically patients who may come in with a hereditary condition where their nose has a bump on the nose. Maybe they have a widened nasal tip, perhaps even a hanging tip of the nose, and also for a crookedness of the nose. Now, many of these things can be inherited from a family member. Some of them can be acquired through sports injuries or accidents, motor vehicle accidents, although the incidence of trauma to the nose has decreased since airbags have been employed for the past 15 years. So oftentimes patients will come in with either one of those conditions or a combination of those conditions. When we see a patient here, we will typically take a look at the nose, not only from the profile to see the shape of the nose, but we'll also look at the internal anatomy. And that's what I'm trying to show on this particular model, is this half-face model that when we look into the nose, there is a dividing wall between the left and right part of the nose known as the septum. And then beyond the septum, where you see these little colored objects, these are the sinuses of the nose. So most people, think about their sinuses when they have a cold because of pressure sensation or pain. And these are basically air-filled spaces that equalize with the surrounding pressure. And when there's any type of blockage from the nose, the pressure between the sinuses and the surrounding air is different, and that can elicit the feeling of pressure or pain. So one of the things that we always do is a complete and thorough nasal examination to check the condition of the septum along with the little structures known as the turbinates of the nose. These are structures that are 3 in nature on each side of the nose, and they help produce humidity for the inside of the nose. They also function for the sense of smell in the top part of the nose. So it's very important that we assess all those types of factors. So if a patient's coming in and they're concerned about a bump on their nose or a hanging tip of their nose, we need to look on the inside and make sure that everything is clear. One of the advantages that we have is that we do both functional as well as cosmetic surgery. I am a double board certified facial plastic surgeon as well as an ENT trained surgeon, meaning that I have specific training related to the functional aspects of the nose. So when we perform a procedure for a patient, if it's purely cosmetic, we are typically working on the outer part of the nose. Most of those incisions are created from the inside of the nose, and occasionally we may need to make a small incision on the base of the nose known as the columella. And those are typically reserved for cases that are more complicated, or somebody who might have a very severely twisted nose, or maybe they've had nasal surgery in the past. And so one of the unique things about our practice is that we take care of patients who have never had nasal surgery before, but we also have about 20% of our patients who come to us who have had surgery done sometime in the past. And that's known as revision rhinoplasty. Revision rhinoplasty is a more complicated type of surgical endeavor because there's scar tissue, and sometimes people might have some nasal cartilage that might be missing, or even a crack to their nasal bone. So let's talk a little bit about the nasal anatomy. The bottom part of the nose is made of cartilage. So this is the part that we can wiggle from side to side. The nasal bones typically start from the base of the nose, known as the rhinion, down to about the mid portion of the nose. These are where the nasal bones are located. And if somebody has a crookedness to their nose, we will have to, in some cases, re-break those parts of the nose. We will have a patient who we will be talking to who had that very condition where we actually had to re-break the nasal bones in order to create a smoother profile. So somebody who is more concerned about the tip of the nose, they don't always need to have the nasal bones worked on. And so the recovery from what we call a tip rhinoplasty is much quicker than somebody who's having a complete rhinoplasty that involves both the bone as well as the cartilage. So everybody is unique, and one of the things, in addition to getting a complete physical examination and a discussion with myself, we take images of that particular patient, and we also use computer technology to do modifications. It's much in the same way that there's computer-aided design that's used to reshape tools and cars and different things. We use that same type of technology to reshape in a three-dimensional fashion the nose on a computer, and then we're able to use that image to help communicate to the patient what we're trying to achieve. In the majority of cases, most people come to us, 90% of patients come to us and they want to make their nose smaller. And that can be from making a smaller hump on the nose, making a smaller tip, making a more narrow nose. One of the things we like to do is to use computer imaging to show patients how much we can actually reduce the nose, because some structural anatomy is not amenable to complete narrowing of the nose, and it's very important that we can communicate that to a patient so that they have realistic expectations. So let's talk a little bit about what happens to a patient who has made a decision to have a rhinoplasty or septoplasty. What is the exact process? What are the expectations? What is the recovery like? The cost? Those types of things that are important. Well, every patient that comes in to see us here gets a full evaluation, and then in addition we have very specific instructions about what the patient can expect to go through. Of course, breathing through the nose is a very important part of daily functions, and when we do surgery on the nose, the first question that patients ask is, am I going to have any kind of packing or blockage on the inside of the nose? And I will say that in the past 20 years, we have slowly moved away from using a lot of packing inside the nose because we have better types of procedures. We also have better types of soft silicone splints that we use inside the nose, so that there's really no need for any packing. And once we get through that part of the discussion, patients are very relieved to know, because when they talk to a friend or relative, one of the most memorable parts of their experiences was having the packing removed from the nose. Nowadays, patients come in after they have their procedure done. We see patients back usually about 3 to 4 days after their surgery. There's no packing in the nose. They may have a soft little plastic silastic splint to help them breathe better during those first few days where swelling is most significant. And patients will be able to resume most normal activities after about 1 week. Now, the operation that's performed is done in our fully accredited private surgical facility here, both in Palo Alto as well as in San Mateo. So we service patients from all over the Bay Area. The patient will typically have their procedure performed under a general anesthetic. That is where we have an anesthesiologist that makes the patient comfortable. They're totally asleep, so they're basically brought into the operating room. The last thing they remember is listening to some soft music, and the next thing they remember is being in the recovery room with one of our recovery room nurses, helping them breathe and apply ice packs to the surgical areas. Patients do not have to stay overnight in a hospital after most rhinoplasty surgery, but they can be returned to home in a more comfortable environment. We have very specific instructions for what patients will need. The most important being the use of ice packs to help reduce swelling. We also use homeopathic medicines such as bromelain and arnica, which really helps reduce swelling as well as postoperative discomfort. The other common question patients ask us is, how painful is this procedure going to be? And that varies, but I will tell you that 90% of our patients do very well with a mild pain pill for the first 2 to 3 days after their procedure, and then they're switched over to Tylenol usually by about day 4 or 5. Afterwards, for the next couple of weeks, there is some sensitivity to the structure of the nose. There is still some numbness to the tip of the nose, and all that tends to resolve. Because we're reshaping the nose, there's also a little bit of tape and a splint that is placed on the outside aspect of the nose that's usually only kept on for about 1 week. So patients can return to school, they can return to work very easily after 1 week. There are some restrictions on extreme physical activities, sports activities, because for the first 4 to 6 weeks after the patient's rhinoplasty, the nose can still be vulnerable to pressure injuries. So the last thing we want to have happen is to somebody who has just gone through their rhinoplasty surgery, something they've been waiting for several years, and then to be either in a basketball game or a soccer friendly match and have an accident happen where a ball or an elbow can traumatize the nose and shift things out of position. That type of scenario has occurred, and we just remind patients that for the first 4 to 6 weeks to refrain from that type of activity. So for a lot of our sports people who engage in both college sports as well as high school sports, we typically will perform their rhinoplasty at a period of time when they're not at the height of their competitive schedule. So we basically summarized the indications for rhinoplasty. I've talked a little bit about the procedures that are involved and the recovery. The other common question is, what is the cost of rhinoplasty, and can insurance cover any part of the cost? Insurance helps treat patients who have functional issues of their nose, and sometimes there's a crossover between functional issues and cosmetic issues. And so depending on if there's been an injury to the nose, we do work with just about every insurance company to review the facts of a case. And if a patient has had a significant trauma to their nose, which not only has buckled the tip of the nose, but also produced a nasal deviation, oftentimes we can obtain some sort of coverage from their insurance to cover that part of the procedure. Typically, if a patient comes in and they have absolutely no insurance and they want to know what is the cost of having a rhinoplasty, the cost will vary anywhere from $5,000 to about $12,000. Now, those are comprehensive costs that cover not only the cost of the surgery, but the cost of the operating facility and the cost of the anesthesiologist. For most patients who do have some sort of insurance coverage, their out-of-pocket expenses could be more in the range of $3,000 to $5,000 instead of the $5,000 to $12,000 picture. So we also tell patients that once we're able to perform their rhinoplasty, their nasal surgery should really last a lifetime. We do know that the nose does change with age, and sometimes after 15 to 20 years, if there's more issues with the aging process where some of the ligaments holding the nose may have fallen, we do go in and do a little bit of revision work. But most of the time, patients will only need 1, maybe 2 rhinoplasties during the course of their lifetime. So you can visit premierplasticsurgery.com and come over to the nasal surgery aspect of the website under the surgical tab. And there you'll see a number of examples of patients of before and after images. In addition, we summarize the procedure as well as the recovery process. And there is a nice computer tool that we have which allows you to take a picture of your own nose, maybe have a friend take a picture from the profile or from the front. You can upload that image to our website graphics tool, and you can make some changes to your nose through some of this computer-aided design programs and bring those images with you along with pictures of ideas of how you'd like your new nose shape to be. Of course, after you come to visit us, we'll take some more specific photos of your nose and show you in profile and send you via email some modified images so you have a better idea of what type of nose you might be able to achieve. So with any type of surgical procedure, there are risks involved, and we do discuss those types of things. Fortunately, rhinoplasty is one of the safest procedures that's performed in plastic surgery. It is also one of the more complicated types of procedures performed, but because The techniques that we utilize, the environment that we utilize, the incidence of complications of having a nasal bleed or nasal infection or having some sort of injury to the soft tissues is quite rare. And so overall the incidence of nasal complications is less than 2%. So if a patient does unfortunately have any type of issue, we work with that patient to make sure that we can achieve the most optimal outcome. So it's been a pleasure speaking with you today. Again, this is Dr. James Newman coming to you from Premier Plastic Surgery in both Palo Alto and San Mateo, California.